Hi everyone, my name is Med2Med. This video is going to be all about sarcoidosis. This is a term which is thrown about a fair bit in medicine and can come up in many different specialities, so it's definitely something you should be familiar with. These notes are based on the following resources. I've been using Scott's Notes, the Oxford Handbook of Clinical Medicine, and NICE guidelines. As a disclaimer, I am a third-year medical student. This video is not intended to be a substitute for any professional medical advice, and you should always consult your doctor about any health concerns. Sarcoidosis is a condition that we call a multisystem granulomatous disorder of an unknown cause. But what is a granuloma? Well, it's a collection of many macrophage cells that occur in response to chronic inflammation. And its purpose is to isolate any infection, so it's often seen in TB or foreign substances like keratin. So it's our body's natural defense against pathogens. We've mentioned that it's a collection of these cells called macrophages. These are white blood cells that engulf and digest pathogens via a process called phagocytosis. It's worth noting, however, that when they're in the circulation, we call them monocytes, and they become macrophages when they migrate into the tissue. A little bit about who gets sarcoidosis. Well, it's more common in women than in men, and occurs generally around the ages of 20 to 40 years old. People of African or Caribbean descent are more likely to be affected, with worse effects than Caucasians. And we now know that the disease is associated with HLA-DRB1 and DQB1 alleles. If this is an acute case of sarcoidosis, the patient may present with the following symptoms: a fever, erythema nodosum, which is an inflammatory disorder of the fat, polyarthralgia, so pain in multiple joints, and bilateral hyalur lymphadenopathy. This is erythema nodosum, which causes these swollen patches of fat. They're often quite painful and are most commonly located in the front of the legs. They're also associated with a few other illnesses too, like inflammatory bowel disease such as Crohn's, so it's important to be able to recognise and associate what illnesses these may come up in. Bilateral hyalur lymphadenopathy is this enlargement of lymph nodes on both sides of the pulmonary hyalur, so that's the mediastinal lymph nodes. You also see this in infections like TB, in interstitial disease, and also in malignancy, so it doesn't always mean sarcoid, but if you have the other symptoms we've mentioned, you should always consider sarcoidosis as a possible manifestation of this disease. 90% of people with chronic sarcoidosis have abnormal chest x-rays, which generally show that bilateral hyalur lymphadenopathy we talked about. The symptoms, though, that they may describe are dry cough, progressive dyspnea, so breathlessness, reduced exercise tolerance, chest pain, and over time, a deterioration of lung function. Sarcoidosis isn't just a pulmonary disease. As we've mentioned at the beginning, it's a multi-system disorder. Let's look at this in more detail. So first, we have brain manifestations, which can lead to things like meningitis, Bell's palsy, and neuropathy. Then, in the eyes, you may notice that the patient has conjunctivitis, uveitis, or glaucoma. We've already mentioned erythema nodosum, so we know that the skin is also affected. Patients may develop cardiomyopathy and arrhythmias in the heart. In terms of the kidneys, patients may get renal stones or raised calcium levels, so that's important to pick up on blood test. The mechanism behind this is actually quite interesting. So we now know that there's loads of these macrophages being released into the circulation in order to form these granulomas. But macrophages actually release substances which promote the absorption of calcium, which is why you'll see these raised calcium levels in these patients. There are so many other places that sarcoidosis can affect, so just be aware of these. For instance, It can alter the pituitary function or affect the parotid gland too. So there's loads of different tests you can do depending on how the patient's presenting and where you need to look. In terms of bloods, you may notice a raised ESR or LFTs and lymphopenia due to T-cell depletion. If you do a 24-hour urine test, you will notice this raised calcium level that we spoke about. ECGs can show arrhythmias if there is cardiac involvement. Lung function tests may show reduced lung volumes or other impairments. Tissue biopsies may be necessary. A bronchoalveolar lavage shows increased lymphocytes in active disease and increased neutrophils with pulmonary fibrosis. Ultrasound can show this organomegaly that can occur, so that's hepato or splenomegaly. Bone X-rays may show lesions in bones, and CT and MRI is also useful for assessing the severity. Let's look into staging this condition. First, we have stage 0, which, as it sounds, is completely normal. Then stage 1, you start to see this bilateral hyaluro. In stage 2, you have both BHL and peripheral pulmonary infiltrates. In stage 3, you are seeing purely infiltrates, and then lastly in stage 4, it's this really fibrotic lung, this honeycomb structure on CT, and pleural involvement. Usually, we leave patients with acute sarcoidosis alone and simply recommend bed rest and NSAID usage. They're usually self-resolving. But in chronic sarcoidosis, you might need to progress to medical intervention. This may be considered if there is lung disease, uveitis, so that's the inflammation of the eye, hypercalcemia, or any neurological or cardiac involvement. In order to treat, we give 40 mg of the steroid prednisolone for about 4 to 6 weeks. But if the case is severe, then you should think about giving immunosuppressants, so that's things like methotrexate, hydroxychloroquine, and cyclosporin. Great, let's have a quick recap. Sarcoidosis is a multisystem granulomatous disorder, so you'll find these granulomas all over the body. It is more common in women, 20 to 40-year-olds, and African Caribbeans. Symptoms of acute sarcoidosis include a fever, skin manifestation like erythema nodosum, polyarthralgia, and bilateral hyaluro. If sarcoidosis manifests on the chest, the patient may develop a dry cough, become breathless, have chest pain, and when lung function tests are completed, there may be a decline in function. It is a multisystem disorder. There are many other signs and symptoms you may see, such as cardiomegaly, arrhythmias, renal stones, conjunctivitis, and Bell's palsy. When you stage sarcoidosis, you look for this bilateral hyaluro. You look for any pulmonary infiltrates and whether it has led to fibrosis. Acute sarcoidosis can often be left alone as it is self-resolving, so just advise bed rest and NSAID usage. But in chronic sarcoidosis, you might need to treat with 40 mg of prednisolone for 4 to 6 weeks, or immunosuppressant therapy like methotrexate if it is a severe case. And that's it. Thank you for listening.